Ms. Starks. I'd like to ask you a few questions.
Hi, Heather. Nice to meet you. Thank you for having me today.
Tell me about a time in clinicals at FTCC in which you delivered high quality, patient centered care to individuals, families, groups, and communities in varied settings.
During one of my clinical rotations, I had a patient that was critically ill. I was responsible for performing her daily activities of living. As I was giving her a bath, I noticed she was extremely cool to the touch. Her mouth and lips were very dry and cracked. I completed her bath and notified the nurse in charge about the situation. We then contacted the secretary and asked for her to order a bear blanket. Once I was able to retrieve the bear blanket, I covered her up appropriately and repositioned her on her left side as she requested. I then performed additional mouth care, including a special moisturizer for her lips. During my hourly rounds, I reassessed my patient. Her temperature was now 98.8. Her lips and mouth were no longer dry or cracked. As soon as I was leaving the room, her family and a group of church members came to visit. One of the family members asked if it was okay to pray, so of course I offered them some privacy and let them know that it was okay to do so.
Why does this example meet the objective?
I believe this objective was met because I was able to provide accurate information and provide high quality care. The patient was no longer cool to the touch. She appeared to be comfortable and was resting in bed. While the family members were visiting, they stated they were very happy and pleased with her appearance.
Tell me how you use something that you learned in one of your class assignments to incorporate best practice and professional values and standards into compassion and nursing practice.
During one of my class assignments, we were focusing on medication administration. The assignment given to us was to identify the medication errors. I was able to identify the medication errors in which they sounded alike. That was given to the patient by mistake. Because I was familiar with this type of medication, I was able to identify the differences in the medications.
Did the outcome of using this new knowledge improve the outcome of the situation that you used it for? Why or why not?
Yes, this improves the outcome of administering the correct medication. I was already aware of these type of medication errors that occur from medications usually sounding alike.
Tell me an example of how you demonstrated cultural and global congruency in healthcare environment with diverse populations in promotion of healthy lifestyles and preventative healthcare screenings during your clinicals at FTCC.
I had the opportunity to participate in the global vaccinations against the coronavirus, which included people of different cultures. During this preparation, I was responsible for setting up the vaccine stations for people who were coming in to get their vaccines. After setting up the stations, I was able to administer the Pfizer and Moderna vaccine to different people, including various ages and cultures. At the end of the day, I was able to vaccinate 80 people.
How does incorporating this impact how and what you present in your patient discharge information and education?
Upon discharge after the vaccination, I informed the patients of the side effects and what they need to do in a particular situation. Also, asking them to stay 15 minutes after the vaccine was administered to see if they had a reaction. If they went home and they experienced any issues such as hives or shortness of breath, I informed them that they needed to call the provider immediately or they needed to call 911.
Describe a situation in SIM or clinicals at FTCC where you functioned as an effective team member of the healthcare team, demonstrating excellent intra-professional collaboration.
I had a patient that was taking multiple antibiotics. I was responsible for toileting this patient who had loose bowels. Upon answering the call light, I noticed feces was on the floor from the bed to the bathroom. I finished toileting and washing the patient and cleaned up the feces as well. I then called housekeeping to come in and mop the patient's floor for extra precaution because he had C. diff.
What skills have you learned in classes at FTCC that have increased your communication skills in SIM and in clinicals?
One of the skills I learned was communication during CPR. My task was to carry out effective CPR on a coded patient. My role was to organize the group and ensure everything was done appropriately, with the right procedure and time. I told one of the nurses to drop the bed while I assisted placing the backboard. Then we started to perform compressions. The results were that the patient's blood pressure returned within normal defined limits. I have improved my communication skills with working with my peers as a team to provide correct information and to provide competent care for better patient outcome.
Describe how you have demonstrated beginning skills in point of care leadership, management, and care coordination using effective communication skills through either successful completion of a class project or a clinical situation or experience.
I was assigned to a group project and the presentation of diabetes mellitus. I was responsible for coming up with the various lifestyles to help prevent this disease. I went ahead and did some research. I collected data and presented it to the rest of the team members. As a result of this knowledge, we were better able to identify the prevention of the disease of diabetes mellitus and to communicate more effectively as a team to our patients during our clinical rotations.
How do you plan to grow and strengthen your leadership skills in your practice as a nurse?
In order to continue to strengthen my leadership skills, I plan to continue to do research and collect data, which will allow me to communicate more effectively. As a result of this strategy, I was able to communicate better with my patients and peers.
Describe how you implement safe and competent care to individuals through both system effectiveness and individual performances in varied healthcare settings.
I had a patient who was taking heparin, which is an anticoagulant medication. I was responsible for administering the medication as per doctor's orders. Before I administered the heparin, I went over the lab work and noticed that the PTTs were out of range. So I held the medication. I contacted the provider and he changed the orders. As a result, the patient was given a safe dose, and it was also confirmed by another RN.
Tell me about a specific clinical situation in which you identified something unsafe for the patient, and what did you do about it and why? Would you change what you did then, now? If so, why? And what would you do differently?
During one of my clinical rotations, I was assigned to 3 patients, all of whom were on fall precautions. I do hourly rounds to ensure everything is in working order and that everyone is safe. At about 5 p.m., I went to check on my patients. As I entered the room of one of my patients, I noticed that the bed was very high. It wasn't locked. The alarm wasn't on either. The call light was on the floor, and the sheets were too. I immediately picked the sheets up. I lowered the bed, locked it, and I put the bell alarm as well. I placed the call light in reach of the patient, and then I also instructed the patient to please not get up. If they needed any assistance, to please use the call light. Someone would be in to help them as soon as possible. As a result, the chance for fall and injury was reduced, and the patient was at lower risk. No, at this time, I would not change anything. I believe what I did decreased the risk for major falls or injuries at this point.